Hi everyone, once again, welcome to Apta EmpowHer, where we decode women's health one podcast at a time. I'm Dr. Akshata Kamath, founder and plastic surgeon at Apta Clinic. We have with us our wonderful friend yet again, Dr. Lakshmi, senior consultant endocrinologist at Magna Centers for Diabetes, Obesity and Endocrinology. Hi, welcome again.
Thank you for having me.
So today I wanted to discuss something which is really common among us women in the reproductive age group, and since it's September and it's PCOS Awareness Month, I wanted to talk in detail about PCOS, what it is, how we can treat it or prevent it. So my first question to you would be, what is PCOS? Everyone says I have PCOS, but what is it?
So, PCOS is a very common disorder, like we said, in the reproductive age group, but it can be seen in older women also. So, it is a hormonal disorder, as we all know, but we have to remember that not all PCOS subtypes or all women who have PCOS have the same manifestations. It's a syndrome. It can have many manifestations. So usually we see that, they come with menstrual irregularities or hirsutism, unwanted hair, or acne on the growth, or ultrasound morphology, which is suggestive of PCOS.
Right.
So that can be a cluster of symptoms, or, something which is in isolation. It's a heterogeneous group of symptoms which we, commonly see.
How do you decode? Like, now there are two components to it, Alva. There is, people say PCOS is different, PCOD bere. So
no, I think the correct term now use ಮಾಡಬೇಕಂದ್ರೆ PCOS ಅಂತಾನೆ ಹೇಳಬೇಕು, Polycystic Ovarian Syndrome. So as it is ಹೆಸರಲ್ಲೇ ಇರೋ ತರ, it's a syndrome and it's a hormonal disorder which can be treated.
So ಕೆಲವರಿಗೆ one or two symptoms ಇರಬಹುದು, ಕೆಲವರಿಗೆ ಎಲ್ಲಾ ರೀತಿ symptoms ಇರಬಹುದು, but ಕೆಲವರಿಗೆ symptoms ಇರಲ್ಲ.
Correct.
So let me move on to my next question. There comes a woman to me and she says, ನನಗೆ ಕ್ಲಿನಿಕಲಿ ಏನೂ ಇಲ್ಲ, ಬಟ್ ನನಗೆ ಪಾಲಿಸಿಸ್ಟಿಕ್ ಓವರೀಸ್ ಇದೆ ಸ್ಕ್ಯಾನಿಂಗ್ ಅಲ್ಲಿ, ನಾನು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೋಬೇಕಾ ಇಲ್ವಾ?
ಸೊ ಈಗ ನಾವು PCOS ಅಂದಾಗ ಅದರ ಡಯಾಗ್ನೋಸಿಸ್ ಹೇಗೆ ಅನ್ನೋದು ಇಟ್ಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಈಗ ಬರೀ ಅಲ್ಟ್ರಾಸೌಂಡ್ ಅಲ್ಲಿ ಪಾಲಿಸಿಸ್ಟಿಕ್ ಓವೇರಿಯನ್ ಮಾರ್ಫಾಲಜಿ ಅಂತ ಏನ್ ಹೇಳ್ತೀವಿ ಅದಿದ್ರೆ ಸಾಕಾಗಲ್ಲ. ಸೊ ಈ 3 ಕ್ರೈಟೀರಿಯಾ ಇದೆ. ಯೂಶಲಿ ನಾವು ಒಂದು ರೋಟರ್ಡ್ಯಾಮ್ ಕ್ರೈಟೀರಿಯಾ ಅಂತ ಯೂಸ್ ಮಾಡ್ತೀವಿ ಡಯಾಗ್ನೋಸಿಸ್ ಅಲ್ಲಿ. ಅದರಲ್ಲಿ 3
ಕ್ರೈಟೀರಿಯಾ.
ಸೊ ಇಟ್ ಕ್ಯಾನ್ ಬಿ ಲೈಕ್ 3 ಥಿಂಗ್ಸ್. ಒಂದು, ದೇ ಶುಡ್ ಹ್ಯಾವ್ ಮೆನ್ಸ್ಟ್ರಲ್ ಇರೆಗ್ಯುಲಾರಿಟೀಸ್, ಪೀರಿಯಡ್ಸ್ ಕರೆಕ್ಟ್ ಆಗಿ ಇರಲ್ಲ. ಸುಮಾರು ಜನಕ್ಕೆ ಬಂದಾಗ ಪೀರಿಯಡ್ಸ್ ಕರೆಕ್ಟ್ ಆಗಿರಲ್ಲ ಅಂತ ಇದೊಂದು ಸಿಂಪ್ಟಮ್ ಇರಬೇಕು. ಇಲ್ಲ ಹಿರ್ಸುಟಿಸಮ್ ಆರ್ ಹೈಪರ್ ಆಂಡ್ರೋಜೆನಿಸಮ್ ಅಂತ ಹೇಳ್ತೀವಿ, ಅಂದ್ರೆ ಆಕ್ನೆ ಆಗಿರ್ಬೋದು ಅಥವಾ ಅನ್ವಾಂಟೆಡ್ ಹೇರ್ ಗ್ರೋತ್ ಆಗಿರ್ಬೋದು, ಇದೊಂದು ಸಿಂಪ್ಟಮ್ ಇರಬೇಕು. ಅಥವಾ ಅಲ್ಟ್ರಾಸೌಂಡ್ ಅಲ್ಲಿ ಪಾಲಿಸಿಸ್ಟಿಕ್ ಓವೇರಿಯನ್ ಮಾರ್ಫಾಲಜಿ ಇರಬೇಕು. ಸೊ ಇದು 3 ಕ್ರೈಟೀರಿಯಾ ಇದೆ. ಈ 3 ಕ್ರೈಟೀರಿಯಾದಲ್ಲಿ ಯಾವ್ದಾದ್ರು 2 ಪಾಸಿಟಿವ್ ಇರಬೇಕು. ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನಿನ್ನೆ ಒಂದು ಪೇಷಂಟ್ ಬಂದಿದ್ರು ನನ್ನ ಹತ್ರ. ಅವ್ರಿಗೆ ತುಂಬಾ ಆಕ್ನೆ ಬರ್ತಾ ಇತ್ತು, ತುಂಬಾ ಅನ್ವಾಂಟೆಡ್ ಹೇರ್ ಗ್ರೋತ್ ಇತ್ತು ಫೇಸ್ ಮೇಲೆ, ಬಾಡಿ ಮೇಲೆ ಎಲ್ಲ, ಮತ್ತೆ ಪೀರಿಯಡ್ಸ್ 3 ತಿಂಗಳಿಗೆ ಒಂದ್ಸತಿ ಬರೋದು, 4 ತಿಂಗಳಿಗೆ ಒಂದ್ಸತಿ ಬರೋದು, ಆ ತರ ಕಂಪ್ಲೇಂಟ್ಸ್ ಇತ್ತು. ಬಟ್ ಅವ್ರು ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸ್ಕೊಂಡಿದ್ರು. ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸಿದಾಗ ನಾರ್ಮಲ್ ಅಂತ ಇತ್ತು. ಸೊ ಅವ್ರು ಅಂದ್ರು ನನ್ಗೆ PCOS ಇಲ್ಲ, ಬಟ್ ನಂಗೆ ಈ ತರ ಸಿಂಪ್ಟಮ್ಸ್ ಬರ್ತಾ ಇದೆ, ಇನ್ನೇನ್ ಇರ್ಬೋದು ಅಂತ. ಸೊ ಬಟ್ ನೀವು ಕ್ರೈಟೀರಿಯಾ ನೋಡಿದ್ರೆ 2 ಫುಲ್ಫಿಲ್ ಆಗಿದೆ.
So you needn't have anything abnormal on your scan. Yet you can have PCOS. Now that's something that I've learned today. So you didn't have polycystic ovaries in your scan to actually diagnose as PCOS.
No. And if you have only polycystic ovarian morphology on the ultrasound without patient being symptomatic, then that also is not a diagnosis of PCOS.
Okay. But does that woman require treatment?
Of course, because she has symptoms of hirsutism, hyperandrogenism.
ಏನು symptoms ಇಲ್ಲ
andre of course we are not going to try. They don't fit the criteria itself. Yes.
I understand. So moving on to my next question. Now people come and they say ನನಗೆ PCOS ಇತ್ತು, but ಅದು ಹಂಗೆ ಸರಿ ಆಯ್ತು. How does that happen and does it happen? What's your take on it?
So I think it is manageable, not curable. So PCOS is a chronic disease like diabetes, hypertension, obesity. Adara ಒಂದು chronic disease. Right. It can be managed. So with the right treatment, with, for example, like if somebody is obese, has PCOS, and is having all of these manifestations. Suppose that person were to lose weight. So some of the manifestations of PCOS, come down. They don't manifest anymore when they have managed. So it is manageable,
Okay.
I would say, like most of the chronic
Is it
disorders.
self-limiting? Does it get okay on its own without doing anything at all?
You can't say it is curable, but it is manageable.
Manageable.
Yes.
Okay. And there is another set of people who come and they say, "Naan chanagidini, nange periods once in 3 months baratte, but I'm fine." Well, should they be fine or should they seek medical help?
So there are two implications to this. Suppose somebody is having cycles very irregularly, less than 4 cycles a month. So one is about fertility. So
Right.
there is definite evidence of anovulation. Anovulation andre avrdu eggs correct agi
Yes.
form ಆಗ್ತಾ ಇಲ್ಲ. So fertility ge definite issues barutte. So if somebody is having irregular cycles,
Correct.
then that is a poor indicator of fertility. That is one thing, and you should have at least 4 cycles a year for optimal health. For example, for your endometrial lining, there is there could be an increased risk of endometrial carcinoma if you don't have adequate cycles per year. So that is also very
So
important.
at least 4 cycles
Yeah.
is mandatory.
Yeah,
And if you're not having your cycles on time, you need to consult
correct.
probably an endocrinologist or a gynecologist, right?
So that's what I was coming to. You remember?
Another
So,
very
I remember you being,
yes.
my close friend, and being a plastic surgeon in
That's-
Mysuru, so close. to
that is
me.
why I'm doing the podcast.
So you called me and
The podcast is for me.
so you called me and asked, like, I have a patient with PCOS. Do you see this patient, or should I send to? So definitely, I think endocrinologist consultation is a must for PCOS. I'll tell you why. Because PCOS andre, it can be secondary PCOS also. So there's primary PCOS and there's secondary PCOS. Primary PCOS andre nimge bere hormonal disorder iralla. Andre periods correct agi baralla, salpa ee acne, pimples irbodu, hair growth irbodu, but bere hormonal disorder apart from PCOS iralla. But for example, if you have something known as hyperprolactinemia, there's a hormone called prolactin.
Post-menopausal
No. It
not
can
at
be, prolactin secreting pituitary microadenoma or macroadenoma.
Right.
So pituitary anta ಒಂದು ಗ್ರಂಥಿ ಇದೆ, ಅದರಿಂದ prolactin ಅಂತ ಒಂದು ಹಾರ್ಮೋನ್ ಜಾಸ್ತಿ ಆದ್ರೆ PCOS ಬರುತ್ತೆ. ಇದಕ್ಕೆ ಸೆಕೆಂಡರಿ PCOS ಅಂತ ಹೇಳ್ತಾರೆ. ಸೊ ನಂಗೆ ಸುಮಾರು ಜನ ಪೇಷಂಟ್ಸ್ PCOSಗೆ ಏನ್ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೋತಾ ಇರ್ತಾರೆ ಅಂದ್ರೆ ಸುಮಾರು ವರ್ಷಗಳಿಂದ ಪೀರಿಯಡ್ಸ್ ಆಗಕ್ಕೆ ಮಾತ್ರೆ ತಗೋತಾ.
Primary cause na they would not have diagnosed.
So many hormonal disorders like hypothyroidism, hyperprolactinemia, Cushing's syndrome, all of these can cause PCOS.
Correct.
And when we see patients who have been taking medications for so long, they have no relief. ಅಂದ್ರೆ ಮಾತ್ರೆ ತಗೊಂಡ್ರೆ ಪೀರಿಯಡ್ಸ್ ಆಗುತ್ತೆ, ತಗೊಳ್ಳಿಲ್ಲ ಅಂದ್ರೆ ಪೀರಿಯಡ್ಸ್ ಆಗಲ್ಲ. So that is a primary complaint.
Yes.
So you'll need to look at the
Primary root
cause.
which is very important.
I feel every patient with PCOS should see an endocrinologist once, because in secondary PCOS, I said PCOS is manageable, not curable, but in secondary PCOS, for example, if you treat hyperprolactinemia, PCOS is curable. I mean, you need not have manifestations of PCOS itself. And like that,
done and dusted with one treatment.
One treatment. And if you don't treat that cause and you're just treating the symptoms of PCOS, like you're doing laser, you're taking creams for acne, you're taking, pills for getting cycles, it just won't go away, because you're not treating the cause.
So how do you treat secondary, like if you have a growth in your pituitary? So
that depends on the causes. For example, if there is a small microadenoma in the pituitary which is secreting prolactin, you give a tablet which is to be taken once or twice a week, and that goes away.
Okay.
So it is as simple as that.
Nice.
And that also helps with fertility. You might have seen so many patients coming that ಎಷ್ಟು ಲೇಸರ್ ಮಾಡಿದ್ರು ಹೋಗ್ತಾ ಇಲ್ಲ, ಎಷ್ಟು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡ್ರು ಕನ್ಸೀವ್ ಆಗಕ್ಕಾಗ್ತಾ ಇಲ್ಲ.
When do you suspect, ma'am? Like if they might have it might be secondary PCOS. When do you suspect?
So there are certain pointers to that. For example, ಈಗ Cushing's andre they can have other manifestations. ಅಂದ್ರೆ weight ತುಂಬಾ ಜಾಸ್ತಿ ಆಗೋದು, ಹೊಟ್ಟೆ ಮೇಲೆ ಸ್ಟ್ರೆಚ್ ಮಾರ್ಕ್ಸ್ ಬರೋದು, ಮುಂಚೆನೆ ಡಯಾಬಿಟಿಸ್, ತುಂಬಾ ಕಮ್ಮಿ ವಯಸ್ಸಲ್ಲೇ ಡಯಾಬಿಟಿಸ್, ಹೈಪರ್ ಟೆನ್ಷನ್ ಬರೋದು, ಈ ತರ ಎಲ್ಲ ಪಾಯಿಂಟರ್ಸ್ ಇರುತ್ತೆ. ಈಗ ಹೈಪರ್ಪ್ರೊಲಾಕ್ಟಿನಿಮಿಯಾ ಅಂದ್ರೆ ಪೀರಿಯಡ್ಸ್ ಕರೆಕ್ಟ್ ಆಗಲ್ಲ, ಅಥವಾ ಬ್ರೆಸ್ಟ್ ಇಂದ ಡಿಸ್ಚಾರ್ಜ್ ಬರ್ಬೋದು. ಬಟ್ ಇದೇನು ಇಲ್ದೇನೆ ಬರೀ ಪೀರಿಯಡ್ಸ್ ಇರೆಗ್ಯುಲರ್ ಆಗಿರ್ಬೋದು. ದಟ್ ಇಸ್ ದ ಥಿಂಗ್. ಏನು ಬೇರೆ ಮ್ಯಾನಿಫೆಸ್ಟೇಷನ್ಸ್ ಇಲ್ಲದೆ ಬರೀ ನಮ್ಗೆ ಆಕ್ನೆ, ಪೀರಿಯಡ್ಸ್ ಇರೆಗ್ಯುಲರ್ ಆಗಿರೋದು ಇದೇ ತರನು ಇರ್ಬೋದು. So it's a very nuanced sort of treatment, and not all patients should be treated the same.
Customized to a particular person. I understand. Now when it comes to PCOS, what is your general sort of treatment? How do you go about it?
Yeah.
Is there a sort of lifestyle change that needs to be done?
Yeah.
Is it a holistic approach?
Yeah.
Or is it just only endocrinology approach?
No, I think it's a holistic approach. So it depends on what symptom the patient has come with. For example, if they come with unwanted hair growth, then we collaborate on treating, the hormonal cause of it. And then of course, I send them to you for laser treatment. If somebody is, having infertility issues, then we treat the cause for PCOS or treat PCOS and collaborate with infertility specialists for treatment.
Yes.
So it's a very sort of team-based approach, and everybody has, a major role to play in the manifestation.
A lot of people have also asked me, is there a particular diet we need to follow? And I'm sure I'm going to have a nutritionist on this podcast as well. But what's your take?
There are different types of PCOS. So there's lean PCOS, there's obese PCOS. Most women are obese, like they're overweight or obese. And of course,
I've also seen
lean, thin patients. So it is very genetic also. You can have genetic sort of makeup to have PCOS. So it differs. So if you're looking at lean PCOS, your treatment approach could differ. If you're looking at somebody who's obese, then of course you need to prescribe a diet which is, which will help with weight loss. But there are so many, things on social media. They say anti-inflammatory diet for PCOS, idu, and also all of that, you should not really believe or follow, and you should only look at evidence-based medicine from a certified nutritionist or a certified endocrinologist.
Yes, I think that's very important. Not from skin influencers and diet influencers. You have absolutely no degree.
Yeah, definitely, and
not backed by science.
Yeah, and after they followed it for 2-3 years and they're not seeing any results, or ಏನಾರು ಒಂದು side effect ಆಗಿರುತ್ತೆ, ಅದಾದ್ಮೇಲೆ ಬರ್ತಾರೆ, and so many times it's too late and they've lost precious years. Example, when they're trying to conceive, or like that.
So my next question is, how young do we treat them? Like, is there a particular people very young get diagnosed? Should they be treated young? Earlier the better? What do you think?
Definitely, especially when it's linked to obesity and metabolic syndrome. I think the earlier the better.
Okay. How early have you treated people even before 16 years or whatever?
Yeah, so adolescent PCOS again has different criteria for diagnosis and treatment. The same criteria that I said.
But you can get...
Yeah, of course. Yes. So many of them, if they lose, say 5 to 10% of their body weight, their cycles regularize without any treatment. If they are given the right, lifestyle advice, they don't need any medications for them to get periods and all of that. Yeah, so it should start early.
The earlier the better.
Yeah.
My next question to you: why is it so common, Dr. Lakshmi? Why is most of the people now, they say, oh, I have PCOS, why is it so common now?
I think
is it more diagnosed or more known now, or is it because any lifestyle changes, or is it?
I think it's got to do with lifestyle changes. Like we're seeing, a higher prevalence of diabetes, obesity, and other metabolic disorders. PCOS is also a metabolic disorders on the same lines, and that's why we're seeing the increase, because it's linked so much to obesity and metabolic syndrome. I think that is why we're seeing, and also people are more aware now. So you see many PCOS patients who come to you for treatment for acne or lasers. So is there a difference between patients who have acne not because of PCOS, or patients who have acne because of PCOS, or
the chronicity? Yes, it does really. So people who have a background of PCOS and who come with acne, the type of acne that we see is different. The more cystic acne, chronic acne, multiple recurrent acne, and we put them on long-term treatment. But we also tell them to follow up with an endocrinologist. But the thing is, I think people are now not understanding the importance that the advice that the endocrinologist gives is more important than our acne medications. They continue with their acne medications, but they say, oh, I've left that, whatever, metformin or whatever, I've left that long back. My acne seems to have reduced, so I've stopped it. So I keep telling them that, acne medicines can be stopped, but your PCOS medication should continue, and you may have to continue it for lifelong. You never know. But acne medicines, you can stop it.
Yeah, I think what they don't understand is treatment for acne or what you're doing, lasers. It's only symptomatic.
Exactly.
Yeah, like I keep saying that you have a pipe, okay, and you know it's leaking at several places. Patch hakta irtive ಅಲ್ಲಿ. So I think that all of this is like, you know, putting a patch for, you know, at that moment. But if you want to like have a good pipe, you need to replace the entire pipe. So I think that is what, you know, people don't.
So that's what I tell them.
Yeah.
But then I think now it's more of we also give them, so in our clinic, any patient who comes with PCOS, I think we do a thorough checkup. At least from our side, we tell them to do a thorough checkup. We get the endocrinologist, we get you involved, we get the nutritionist involved as well. I think that's very important. And then we see better results in terms of their hair loss or their acne. I think they're happier.
Yeah,
and the results are better.
Yeah, I think especially with laser.
Absolutely.
And I've seen many patients who have undergone like sessions and sessions of laser and don't see results because you're not actually treating.
I in fact sent a patient to you, and then she was quite happy. And the results after that, I think there was more thinning of the hair. She was happy with the results.
They're much better. So I think that is what we need to, you know, build awareness around. That it's a holistic approach, and it's not like one person who can treat this because it's such a complex disorder.
Absolutely.
Yeah.
So, Dr. Lakshmi, what is your take-home message to all of us women in this month? It's PCOS Awareness Month. So, what would you like to tell them?
So, be aware of your health. Be aware of what PCOS is. Be aware that it's a multidisciplinary approach that can help treat PCOS. It's not a single doctor who can treat all aspects of it. You know, you need to see an endocrinologist if you have PCOS. You need to see somebody for, you know, if you have infertility issues, you need to see an infertility specialist. You need to see a cosmetologist. You need to see a plastic surgeon, a dermatologist. So all of this, you know, it's a multidisciplinary thing, and I think you should be aware of that, that if you treat the cause of PCOS, all your manifestations are treated on their own, and that's sort of a what you would say a permanent sort of solution.
I would also add to that saying, don't ignore it because it's not troubling you now, because it might trouble you later.
Yeah, and also what we didn't speak about is PCOS, I said, is a metabolic disorder, but women with PCOS also have cardiometabolic risks, like they have higher chance of say heart attacks, or they have, you know, higher chance of all the complications associated with diabetes that we say also there in women with PCOS. So it's definitely you know, important to, you know, take charge if you have of your health, and you know, work towards being better if you have PCOS. It's not something that you say, oh, I have PCOS, and just brush it off. You cannot do that, because there is treatment. You just need to meet the right specialist to get the right sort of treatment.
Wonderful. Thank you so much. I think this was more of an insight for me as well, and a lot of things have got cleared up regarding this subject. Thank you so much for making time for us.
Thank you. Thank you for having me.
Wishing for more interesting podcasts like this. Thank you.
Bye. Thank you.